I'm Nicole Harter. I'm the Chief of Pediatric Dermatology at Children's Hospital and Medical Center, Omaha, and I'm also an Associate Professor of Dermatology at the University of Nebraska Medical Center. So I'm actually originally from Hawaii, Hilo, Hawaii on the Big Island. My dad was born and raised in Hawaii, and my mom moved there after college, and they met and they had me. All of my father's side of the family is still there, and it's a great place to go visit family over the holidays. Oh, Adele right now. Oh yeah, she's killing it. It's amazing. Can't beat the traffic. I'm gonna say it's been wonderful trying to navigate a city. I'm not a great navigator, I won't lie. My husband's a great navigator, I'm not. And it is so easy for me to get around Omaha. I love that. Everything's very accessible. And I had lovely patients and lovely colleagues and lovely friends in LA. But I will say, even the random strangers I meet here in Omaha are the kindest humans I could possibly encounter. Nicer than I just realized that strangers could be to you. And that's been over the top. Probably the biggest thing I've taken away is that it's just a friendly place to be. So you can see my fun little photo wall. This is my daughter, she's Scarlett, she's 2. She is a lot of 2 right now, a lot of fun, and loves all things outdoors, all things painting, and most things eating. And this is my husband, Joe. Joe is an airline pilot, so he's the good navigator. Hence, he works for Delta Airlines, and we've been together for more than half my life. We met when I was in high school, so he's trekked along, following me around the country for all my training, and I am very, very grateful for him. So it's one of the nuances of being in pediatrics is you have to try and make them feel as comfortable as possible. And it's hard because I deal with age 0 or day of life 1 until 18 or 21. That's a huge spectrum of how you want to interact with someone. So the biggest thing for young kids is I get down to their level. So I spend a lot of my day on the floor or on my knees or on like a low stool, hanging out right with them and letting them explore their environment. I'm not trying to confine them to an exam table or a chair. I usually do put them in a gown because I like to do a full body skin check, but they get to run around, they get to play, they get to open cabinets and touch things and see what the world around them is. I interact with them directly. So of course the parent and I, the family and I are having a discussion, but when I'm speaking, I will ask even a 2 or 3-year-old, tell me about your skin. Did you come in for a lump or bump today? Are you worried about anything? And I'll have them show me their skin themselves. I do use a lot of kind of bonuses or prizes. We have little tiny Play-Dohs and these little tiny squishy toys that we use as bargaining chips as well, and that's a lot of fun. And then I have a dermatoscope, which is a magnifying polarized light that helps me see patterns within different types of lesions on the body. Well, they all think it's just a cool flashlight, and so that's something else I employ, that we just kind of look at fun areas on the body. But I really, really think it's about really directing the care to the patient. So I can talk to a mom or a dad or a grandma or grandpa, but I'm always gonna end my conversation with talking directly to the patient and making sure, especially in that pre-adolescent, adolescent group where they really do have opinions and fears and questions about their skin and their treatment plan, we have to be on board together. I can tell them to do a 17-step plan for their acne, and they're gonna look at me and say, I don't have time for that, or I don't understand that. And so then I have to work with them about creating a reasonable treatment plan. Oh, my favorite part of my job. Probably getting to see a patient and family that are really struggling with severe skin disease, providing, a treatment plan, but usually a lot of education about what this is, what our expectations are, what are our goals for management. And the second time I get to see them, at the follow-up appointment, they've had some improvement, which is great, but just that they understand more of what the prognosis is and where we're gonna be on this journey together. So I really, really, really like educating patients and families and empowering them to understand their diagnosis, their treatment plan, and how they can be advocates for their own health.